Good morning, everyone, and welcome to the Munson Healthcare COVID-19 press conference. Today is Tuesday, August 17th, 2021. Next slide, please. Today, I'm happy to welcome back some familiar faces and guest speakers to share their expertise with us. First, you're going to be hearing from Dr. Christine Nefsey, the Chief Medical Officer for Munson Healthcare. Then Dr. Christopher Ledke, who's an infectious disease specialist with Munson Healthcare, will provide an update on the latest news on the Delta variant. Next, we'll be joined by Lisa Peacock, who's the health officer with the Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. And then lastly, we'll hear from Dr. Jennifer Morse, the Medical Director of District Health Department number 10. And my name is Diane Mihalik. I am the Chief Marketing and Communications Officer for Munson Healthcare, and I'll be your host today. Before I introduce Dr. Nefsey, I do want to point out that we will have a Q&A session today, right after all of the panelists are done giving their presentations. If you are a reporter and you're watching via the Zoom meeting, you can submit your questions via the Q&A function. Or if you're joining us live on Facebook, feel free to submit your questions via Facebook, and we will get to answer as many of them as time allows at the end of today's presentations. Next slide, please. So without further ado, it's my pleasure to welcome back Dr. Christine Nefsey, Chief Medical Officer for Munson Healthcare, to give us an overview of what the latest and greatest on COVID-19. Welcome, Dr. Nefsey.
Thank you, Diane. So we'll start as always with our regional data. And you can see here our cumulative cases and cumulative deaths. But most important, I think, is that bottom square that shows our case percent positivity. So you will recall we had actually dropped below a 2% rate for several weeks. We are now slowly creeping up, and on a 2-week rolling average are at a 6% positivity rate, and over the last week at a 6.5% positivity rate. Additionally, we have currently 176 cases per 100,000 people, which does put us in the high category for spread according to the CDC's metrics. Let's go to the next slide. Currently, we do have 18 positive patients across the Munson Healthcare system with COVID-19. Again, a lower number than what we saw in our most recent surge, but certainly based on what we're seeing across the country, an increase from where we had been, and something that we are monitoring closely. Next slide. Here's just that graphic representation of the same thing. Next slide. And here you can see the trend line for the United States. So, we had that surge, had a nice drop down, and now we're seeing another spike up. We are pretty certain this is secondary to the Delta variant. We have confirmed the Delta variant in the state of Michigan as well as northern Michigan. The most recent update I heard said that well over 90% of the screening that they do for positive tests are coming up positive for the Delta variant. So let's talk a little bit about what that could mean. Next slide. So this is a slide for the United States and what the hotspots are. So that purple color obviously are where we're seeing the highest rate of spread. So you can see big pockets there in the south and in the mountain west. Unfortunately, those high case rates do coincide pretty strongly with lower rates of vaccination in the population. Given we are a travel destination for the summer, and that people are definitely traveling and flying, it is just a cause for concern and just another indication that we're not quite out of the woods yet. Next slide. Just a reminder that our treatment options do remain limited for COVID-19. So vaccination is the best option for prevention. We would like to avoid as much illness, hospitalization, and death as we can. That being said, if you do get a positive test for COVID-19 and you meet the criteria, you are eligible, if you're not sick enough to be in the hospital, to get a monoclonal antibody infusion. So just as a reminder that that is still available throughout the Munson Healthcare system. Next slide. We do still offer vaccine through various different venues. We are no longer doing our mass vaccination clinics, but we are still supporting our primary care physicians across the region in giving vaccine. Our local health departments are still giving vaccine, and many of our pharmacies across the region also are giving vaccine. So plenty of opportunity there if that is of interest to you. Next slide. And then just to go over our percent of our population that is vaccinated, you know, we currently are at about 62% of people that have initiated their vaccination. As a reminder, that does only count those who are eligible, so children would not be included in that percentage. This is just 12 and up. So there you can see for our region, and again, we do tend to have higher rates in Leelanau and Grand Traverse County, but you can see that we do have some counties that have a lower vaccination rate and therefore are at more risk for the effects of Delta. Next slide. We have been hearing a lot in the news lately about booster vaccines. So the most recent indication is to give a booster for people who may be moderate to severely immunocompromised. There's a good definition on the CDC website about what that means. And just as a reminder, this is only for those members of the community that have received their first vaccinations through an mRNA vaccine, so Pfizer or Moderna. It does not include people that got the J&J vaccine. And again, this is pretty well defined by the CDC. It also does give discretion for your physician to make that decision. If they, you know, again, who know you best, decide that you should be eligible given your healthcare history for a third booster dose, please have that conversation with them. Right now, the CDC is not recommending additional doses or boosters for any other member of the population, but as always, this is something that they are continually checking and monitoring, both for high-risk groups as well as the general population. We will continue to monitor their work and adjust our recommendations as we learn more. Next slide. This is just another plea to help us protect others. If you are experiencing any symptoms of COVID-19, please go get tested. This will help our health departments, you know, do their contact tracing and ensure that anybody that has been exposed is aware. Anybody that has been exposed and is not immunized can quarantine. It also will allow us to provide monoclonal antibody therapy for those who are positive, especially or only when they're in that first 10 days of symptoms. And just again, a reminder that there is a high mortality rate to this virus. 2.2% is what we're currently seeing. That is 20 times more lethal than the influenza virus. So please, if you have symptoms, get tested. It will benefit you and it'll benefit the rest of the community. Next slide. This is just sort of a list of resources. I won't read it to you, but you can get on the michigan.gov website. You can get on our website. You can call our hotline. Lots of resources to help direct you towards the right resources, whether that's vaccine, monoclonal antibody, or just knowledge and contact tracing. So please don't hesitate to reach out. Next slide. We also did want to talk about masking recommendations for school-age children. I know a lot of people are getting ready to send their kids back to school, and the American Academy of Pediatrics, the Centers for Disease Control, and the Michigan Department of Health and Human Services all very strongly recommend universal masking as the safest way to return to school. We know from the last school year that having kids in school is the best place for them, but we are also learning that it the safe way to get them in school and staying in school is to be masked. As a reminder that masking protects the child as well as people around that child. We cannot immunize yet any of our kids under the age of 12. So we have a large portion of our school age children that aren't eligible for the vaccine. This most recent Delta variant has a very high viral load, so it is much more transmissible than the virus we were seeing during the last school year. So all of those things together really just support very, very strongly that the way to get kids in school and to keep them there in the school year is to have universal masking. So we would ask you to please consider what the American Academy of Pediatrics and your local pediatrician or family medicine doc says, that masking for both you and your child in school settings or other indoor settings is really imperative. Next slide. And we did want to also report out, we did hear from the state that MICR, which is the Michigan Care Improvement Registry, and where we track immunizations for the state, is working on providing better access to your own shot record. So you don't have to necessarily go to your physician's office or the health department to get it. So it is a broad database. All immunizations that were given in Michigan should be recorded there. You can also, your provider can update if you are like me and got a lot of your immunizations elsewhere. But you can now get on there and request your vaccine records. We think this will help people in understanding, what they or their children might need as far as immunizations. Next slide. So now I'm going to pass back to Diane and invite Dr. Ledke.
Thank you, Dr. Nefsi. We appreciate that update, and we'll have you join us back during the Q&A session. Next, it's my pleasure to welcome back Dr. Christopher Ledke, who's an infectious disease specialist with Munson Healthcare. And Dr. Ledke does not have video capability today, but we're really grateful that he is able to join us through audio. So Dr. Ledke, I know you wanted to talk a bit about the Delta variant and provide some more details for our audience. So I'll let you go ahead and do that.
All right, thanks, Diane. Yeah, what I'd really like to do is give a little bit of background into the Delta and maybe clarify what you may have read in the news and why it's meaningful. So first of all, the Delta is a variant, and just to define variant, so variant is essentially a mutation of the COVID virus, typically in the spike protein. And in order to become a variant that's transmissible, it must be something that is typically more fit or stronger than the wild type non-mutated virus. So the way this works is that the virus kind of hijacks your hardware in your own body to create its own genes, to create more viruses and then spread. So it does that very quickly. It creates genetic material very quickly, and that is typically error prone. So you get a lot of mutations out of that. Most of those would not be viable organisms, but occasionally you will get a virus that is more fit, stronger, able to sustain transmission in the community better than the original virus. And the reason that's important is because that will continue to occur as viral transmission goes unchecked, which you can see, if you pay attention to what's happening globally, places like Thailand and Malaysia and Indonesia and Southeast Asia in general right now are really struggling with high level transmission. And so right now we're talking about the Delta, but this will unlikely be, we will very likely have further variants to talk about down the road, unfortunately. So the Delta variant is termed a variant of concern by the CDC, of which there are several. You'll remember that the large surge we had in April, that was the Alpha variant, which is B117, the UK variant. That was about 50% more transmissible than the original strain. The Delta variant, or B16172, is the current surge, and this one is about 50% more transmissible than the alpha. So it's significantly more contagious than the original virus. And this virus was originally noted in India in March and has become widespread globally since that time. It is significantly more transmissible, as mentioned, and it is now about 95% of new US cases. And we know at least 95% of cases identified in Michigan are Delta. So it's assumed, even though we don't have a lot of sequencing data for our area, we assume that it makes up the majority of the new cases that we're seeing locally. So it has resulted in about 130,000 new cases per day nationwide, which is 10 times that we were seeing in mid-June. So it's creating a significant surge, as it has in many other countries. And you'll see, if you look at what's happening in our country, that it is leading to significant transmission in the South. And some of that is related to relaxed mitigation efforts as well as vaccination rates. Louisiana, for example, is really struggling. And if it were a country, it would be the single highest area for new COVID cases worldwide. So Louisiana is really struggling, as is places like Florida and Mississippi, where their health systems are being put to the test there. One concerning thing I see in this is that, Florida is getting hit really hard with COVID right now, and it's really taxing their intensive care unit and their units and their healthcare workers. The vaccination rate in Florida is actually very similar to that in Michigan, which to me is concerning. It makes me think that we're fairly vulnerable up here. We haven't had such a huge outbreak as they have in the South, but we are vulnerable to that. So one of the questions has been, is the Delta variant more deadly than prior variants? And there's actually not a lot of data on that. We're seeing more deaths nationwide as they have globally, and some of that may simply be related to increased transmission. There was a study out of Scotland over the summer that showed, compared to the Alpha, which was the big most recent surge that we've had, that the hospitalization rate is about 2 times that between Delta and Alpha, meaning that your risk of ending up in the hospital is about 2 times greater with a Delta infection. So it does appear to be, at least in this study, more dangerous. So I wanted to talk about vaccine protection in the setting of Delta, because I think this gets misconstrued and is confusing when reported in the media. So first of all, we know that our vaccines work well, even for Delta. 90% of new cases are in unvaccinated individuals, and 95+% of new hospitalizations are in unvaccinated individuals. A study out of the United Kingdom in July, while they were having a Delta surge, showed a protection of about 88% from symptomatic disease, with what they're using is mainly the mRNA vaccines. So they had good protection there. There was a study out of Israel later in the summer where they were also having a Delta surge. They had protection that was closer to 65%. Now, the difference there is that Israel does a lot more testing of asymptomatic individuals. So it's likely that the protection for asymptomatic disease is lower than that for severe disease. So it appears that for hospitalization and death, that the protection is extremely high, like in the mid-90s, whereas as you get lower in severity, the protection wanes. So that is the difference between Delta and the original strain, and that against Alpha, is that it appears that in lower severity cases that the protection is somewhat lower. So we are seeing breakthroughs. They continue to be rare. Less than 1% of fully vaccinated individuals develop COVID, even in the setting of a Delta surge. the infections in breakthrough cases are typically mild. It would be extremely rare, not impossible, but very rare to develop a hospitalization or death in the setting of full vaccination. One thing that should be clear is that as we vaccinate more individuals, that leads to a higher population of vaccinated individuals. So that will lead to more breakthroughs reported. So, for example, if we had a 1% risk of developing COVID in a population of 1,000 people that are vaccinated, hopefully you will understand that if there's 10,000 people that are vaccinated and the risk is 1%, that you'll have significantly more breakthroughs with that larger population. So that's just the kind of the nature of statistics, is that as the accumulated population of vaccinated folks gets larger, the likelihood of documenting a breakthrough increases also. So there was a study in July that came out and published in MMWR that looked at an outbreak of Delta cases in Massachusetts. And the interesting thing about this study is they were looking at patients who developed COVID who were vaccinated versus unvaccinated, and they actually looked at how much virus they were shedding. And first of all, the patients who were vaccinated had very mild disease, but once they did get infected, they were shedding actually just as much as the unvaccinated folks. So this study, along with what we're seeing is an increased transmission, prompted the CDC to change their mask recommendations in late July, such that they recommend masking in indoor settings regardless of vaccination status. And that depends on the risk in your county. So for example, Grand Traverse County, we have termed substantial risk, which meets criteria for indoor masking. So I think that caught a lot of people off guard, and it may have led to some discrediting of the CDC, but in reality, what's happening is that they're making new decisions based on new information. So back in May, when they allowed the removal of masks for those who were vaccinated, the transmission was very low. And it appeared that even for asymptomatic disease, that the vaccine was working quite well. What we're seeing now is that there is less protection for lower degrees of disease, such as asymptomatic and mild disease. And if the patient does get infected with COVID, that there is a fairly significant risk of transmission, even in the setting of vaccination. So that has led to their new recommendations. It doesn't mean that the initial ones were wrong. It simply means that they are making new recommendations based on new information. So that's typical in the scientific community and in medicine, where we make new recommendations based on new information. It's just not typically this fast, and it's not this heavily scrutinized. So I think it's hard for the general public to understand that these recommendations are going to change, and that doesn't mean that the vaccine isn't working. It's simply a degree of caution that they're adding. So as Christine mentioned, along with this recommendation for masking regardless of vaccination status, it's also been quite clear that the large societies such as the CDC, the American Academy of Pediatrics, and the Michigan Department of Health and Human Services clearly are recommending masking for indoor learning for school-age children, many of whom are unprotected. So obviously those 12 and below wouldn't meet eligibility for vaccination. Those 12 to 18 have actually quite low vaccination uptake. It's probably around 30% nationwide, though that varies from location to location. So hopefully you can see how it makes sense that masking should be recommended in that setting and ideally mandated, as there is very little other protection, and we're in the upswing of a significant surge. That's all I have for now, Diane.
Great. Thank you, Dr. Ledke. I think that was really helpful in enabling us all to understand the different changes and where we're currently at. I really appreciate you taking the time out of your busy day to join us for this. And if you'll stick around, we'll have you back for the Q&A session. But next, I do want to get to some of our health department updates. We have two of our health department representatives, and the first one I'd like to welcome back is Lisa Peacock, who's the health officer for the Benzie-Leelanau District Health Department and Health Department of Northwest Michigan. Welcome back, Lisa.
Thanks, Diane. Happy to be here. Thanks for having me. The great information from Dr. Nefsi and Dr. Ledke. I will just add a little bit of local information, and then I'm happy to be available for questions. So in being consistent with what they've said, certainly things are still ticking up around the region. The rate of increase varies a little bit, although we don't always know why, and we don't know if that will continue to be the trend. What we do know is that currently many of our counties, with just a couple of exceptions, and our region and state as a whole are in either the substantial or high transmission level as designated by the CDC. So that is concerning, and that does tell all of us that we need to be paying attention to those CDC recommendations that are new for both masking and testing. One other thing that we know is that our testing capacity in the north is limited at times, and we're certainly experiencing an increased demand for testing. The CDC has made some new recommendations that regardless of vaccination status, that if you are exposed to someone with COVID-19, they recommend that you be tested 3 to 5 days after that exposure. And certainly anyone who has symptoms needs to be tested. So in response to that, we're trying to increase the capacity for testing around the region. We will have some new drive-through rapid testing available, starting with the Charlevoix Township Hall, the Charlevoix Township Fire Hall on Saturday from 10 to 4. And rapid and PCR testing will be available at that site. There's no appointment needed. There's no doctor's order needed. And the same thing will be happening in Suttons Bay at the old Suttons Bay Middle School on Thursday this week from 12 to 6. So we hope to continue that service weekly in partnership with MDHHS. And we'll continue to add as needed as we move forward. But testing is certainly an important strategy for finding cases and monitoring the pandemic risk and understanding where we stand with everything. So, we certainly support and understand the new CDC recommendations, not just for testing, but also for masking. As one of the previous speakers mentioned, they have recommended masking indoors anywhere for anyone, regardless of vaccination status, in areas where we have substantial or high transmission, which is Northern Michigan right now. And they have made additional recommendations for universal masking for staff and students in schools. And I just want to mention that in addition to protecting our children, who are the remaining group who cannot yet be vaccinated, they are our most vulnerable group at this point. And so that, certainly is very concerning. But masking also is just a really important mitigation measure that allows for our kids to remain in school with in-person learning, which we know is so important for their development and for their educational success and really just life success going forward. And so, it is an important mitigation strategy in protecting us from health risks, but also protecting us from many other risks, including disruption to that in-person learning. So, we know also that getting vaccinated is the best way to protect everyone who is vulnerable. We certainly are providing that third dose to people who have identified with their doctor that they need it. But really the most important strategy is getting everyone certainly their first initial dose and getting everyone fully vaccinated. That's what's going to ultimately drive down transmission and protect everyone who's vulnerable, including those who are immunocompromised and our children. So I think with that, I will stop, and I'm happy to answer questions at the end.
Thank you, Lisa. And I will just mention, as part of all the information you gave on masking, that per the CDC's recommendation and our own protection in early August, Munson Healthcare did move back to universal masking in all facilities. So if anyone is coming to Seek services at Munson Healthcare. You will see all of us wearing masks while we are indoors. I'm in a private office right now, so I don't need to be masked, but as we're out and about in hallways and throughout our hospitals and facilities, and we please ask for your cooperation with this because we are asking all patients and visitors to be masked as well. On that note, I will love to introduce and welcome back Dr. Jennifer Morse, who's the Medical Director of District Health Department 10, with our final Health Department update for the day. Welcome back, Dr. Morse.
Thank you. So we continue to see cases increase as well, and our percent positivity is also increasing quite a bit. We actually now have 8 of our 10 counties that have had the Delta variant identified. We just were notified today that Kalkaspia County has had a positive identified, and I'm sure all 10 of our counties have the Delta variant present in large amounts. We just haven't yet identified it due to lack of sequencing in all those counties. Our vaccine numbers continue to creep up slowly, but we're not seeing as much as we would like to. We are offering and administering 3rd doses to all those who do qualify. We do have scheduling available online and by phone, so you can see that on our website. We do continue to offer pop-up vaccination events throughout. We have continued to communicate regularly with our schools. I do hold meetings with them, as do our health officer and other partners in our health department. And we also vocalize that we do strongly recommend that they follow the recommendations of the CDC and MDHHS, and of course ourselves, that they have universal masking throughout the schools, K through 12. We have had many questions from the community about why we don't place an order from public health, and we recommend, as MDHHS does, that the schools mandate the masking because they have better ability to enforce those rules. For us to have an order, we lack the ability to really enforce that. We would rely on the schools to enforce any order that we would place. So we're continuing to try to educate the community on how all of that works. Again, we are advising the schools to mandate masking and trying to provide them with education and resources and things like that. Because again, an order from public health really doesn't have any significant ability to enforce that. So we know there's a lot of frustration in the community about all this right now. And so we just continue to try to help as we can. So I don't believe I have any other new information, but I am available for questions as we complete the press conference. So thank you.
Thank you, Dr. Morse. Appreciate that update. So now I'd like to welcome back all of our panelists today. We do have a lot of questions that have come in to our panel. As a reminder, if you're a reporter, please submit your question via the Q&A feature on Zoom. And luckily, we are seeing a lot of questions coming in from the Facebook Live feed as well. So I'm going to get right to it and start with asking Dr. Nefsi to comment on a question from a reporter. It's a 2-part question. And since you are a pediatrician, the question is, I wanted to ask if you've seen an increase in pediatric hospitalizations due to COVID-19.
Yeah, as of now, locally and in the state, we have not seen an increase. We are following very closely other states which are surging a little bit ahead of us that have seen a substantial increase. And if you'll recall, many of the pediatric hospitalizations for COVID were around that MIS-C, which develops several weeks after the initial infection. So this is something that we're very concerned about, especially as we head into fall and winter, which tends to be the busy time for pediatrics with other upper respiratory things like RSV and parainfluenza and influenza. So we are not seeing an increase in those pediatric hospitalizations currently, but it is something we're quite concerned about and following closely.
Thanks, Dr. Nefsi. And the second part of that question is, the reporter also wanted to know, is there an overview of the sorts of symptoms and severity that children are coming into hospitals with related to COVID-19?
Yeah, so there's two things. One is just your normal symptoms that most people get, or the average person gets, and we have those listed all over. Those haven't really changed much. Pretty consistent with other upper respiratory things and flu-like illnesses. The thing with children with the MIS-C is it's really like a multi-system inflammatory response. So we tend to see other things, almost sometimes stroke-like problems or clotting, neurologic issues. There's it's a much different disease in children when they develop that MIS-C.
Thanks, Dr. Nefsi. The next question I will ask of Dr. Ledke, and others can weigh in as needed. Dr. Ledke, you mentioned breakthrough cases. Do we know how many breakthrough cases we're seeing in the area currently?
Yeah, I wish we had that data. When we pull up the dashboard, or if you were to look at some of the websites where they show new COVID data, a lot of it is either hospitalizations, deaths, or new COVID cases.
Okay.
It would be really helpful if we had more information, like what age these new cases are, if they're vaccinated or not. Things like that. As I mentioned, it would be rare for a fully vaccinated individual to come into the hospital, so we haven't seen much of that. As far as those in the community who are getting diagnosed with, a mild, low-grade case who don't end up in the hospital, I've certainly heard of cases like that, but I can't give you hard data on that.
Okay, thanks, Dr. Ledke. And I think as we all evolve through this pandemic, we know that the data available to us continues to evolve as well. So hopefully we will begin to start tracking that.
That data is, I was just going to say that data is available from time to time. If you go to the Michigan coronavirus data page, there's one area that says data and modeling updates, and each week that's published. And if you scroll through, they usually give an update. So this last week, between January 15th and July 21st, they reported that there were 8,700 total breakthrough cases in the state of Michigan. And that was out of, well, to put it in percentiles, that was 0.189% of all of our total COVID cases during that time frame. So there is a data breakdown on a slide on that data set. It's slide 51. And so that is a wonderful data analysis that is put out each week. It's just kind of buried under, you have to click about 5 times to find it.
Yeah, I was not aware of that. That's good.
Yeah, I can send it to you. Yeah.
Thank you.
Yep.
Thanks, Dr. Morse. See, we're all learning something new here, so that's great. Thanks, Dr. Ledke and Dr. Morse. The next questions, and there's a few questions along a similar vein, I'm going to ask of Lisa Peacock and Dr. Morse in our health department if they know, but what is the best way for someone to either get a booster shot, sign up for one, or will they be notified that they are eligible, or do they have to go to their doctor and determine if they're eligible? Or, Lisa, I'm going to let you comment on this first to see what's working currently in your regions right now.
Sure. Currently, and I think this is pretty consistent across most of our northern health departments, but Dr. Morse, jump in if I'm not correct. At my health departments, at least, we are asking people to talk with their doctor. No, they will not be notified that they are eligible for that booster. It's a discussion between them and their doctor to determine if their health status warrants that. There's a list of some examples that are listed on all of our websites of conditions that may cause you to be moderately to severely immunocompromised. But what we are asking for is for people to have that discussion with their doctor. They're welcome to schedule the same way anyone can schedule an appointment or walk in. We are asking that they bring a note or a prescription from their doctor if they're able to. Certainly, if there are barriers to that, we will talk to them about it. But that is a discussion best had with one's doctor.
Thanks, Lisa. Dr. Morse, any additional comments from your jurisdiction?
Yeah, we've added a list of those conditions on our COVID vaccine website, and also a link to the CDC website. I also know some of the local pharmacies have done similar Currently, we're not requiring a prescription or a note if people fall into one of those recognized moderate to high immunocompromising conditions. If they're requesting a vaccine, a third dose for a condition outside of that, we do ask that they talk to their healthcare provider and do get an order. Other than that, we just ask that they do confirm that they have one of those conditions. But we do again have those listed. And our staff and our schedulers do have a more detailed list of all the exact conditions and drugs and things. So if people have questions, they can call us to confirm.
Great, thank you, Dr. Morse. The next question is for Dr. Nefsi. You mentioned COVID-19 and the MISC in children. Do we know if one variant of COVID-19 causes a higher rate of MISC in children or not?
It's way too early to tell, whether that complication is just sort of by nature of a child's response to the virus, or if it's a variant specific thing. But certainly if we look at what's going on in other countries, we would assume that it's as likely as the last variant, if not more, that children will develop MISC from the Delta variant than they would from any other variant. There's no reason and no data that I've seen so far from other places to suggest otherwise.
Great, thank you. And Dr. Ledke, along the same lines, do we know if the Delta variant is more transmissible in children as opposed to adults?
It's more transmissible than the original strain and the Alpha in both children and adults.
So both.
So regardless of your age, it's going to be more transmissible than what we've seen in the past.
Great, thank you. Next question is for Dr. Nefsi. We don't have Dr. Torney on today to talk about specific vaccines, but I'd like to know if you've heard anything about this. We have several questions on the effectiveness rates of particular vaccines. Some reports have suggested that the Pfizer vaccine loses effectiveness after 6 months. Is this believed to be the case based on available evidence?
Actually, Dr. Ledke might be able to answer this better, but I can go ahead and start us off. There are a lot of studies being done on all of the vaccines looking at efficacy with time. And just to bring people back, we have many, many vaccines that we use that require boosters. So you get a tetanus booster every 10 years, you get a flu booster every year. So the idea of boosters in itself is not unusual. And just with this newness, we're just not sure. And the problem is it's complicated also by the fact of seeing natural disease in the community. So we are following that. The companies are following that. There is some evidence that certain population types might not have as robust an immune response, and that's why you're seeing this consideration for people who are moderately to severe immunocompromised to get a booster. There have been some preliminary studies that show age might also impact the immune response, but again, that's likely related to that. I think most of us expect at some point a booster will likely be indicated. We just don't know the timing yet. There have been some news stories today about an 8-month mark. Again, I haven't seen the studies around that yet. And if that's the recommendation, we will absolutely follow it. But maybe Dr. Ledke has seen a little more data on that and can add to my response.
Yeah, that's a good summary. So absolutely, the waning immunity seems to correspond to a few things, one of which is age, the other of which is the underlying immune status, which is why they're beginning this booster campaign with the most immune suppressed. So they're talking about solid organ transplant or equivalent. That's how they describe it for this first round of boosters. And how I see this playing out is kind of a stepwise fashion, where they'll get the most vulnerable first, and eventually get to a point where they will reboost the general population. So if you are wondering whether or not you qualify, I would basically stay tuned, pay attention to what is meeting the criteria for a booster at this time. And then if you see that reported and think that you may qualify, then talk to your primary care physician. But at this point, they're being pretty restrictive to the most immune suppressed.
Okay. And Dr. Nefsi, I think that it's not just the boosters that people are wondering about. I think for those who have not yet been vaccinated or had their first dose, I think some people are trying to weigh, is there one vaccine that's better than the other? And I know you've said this before, but I'll let you say your answer again.
Whichever one works for you and is available is the best vaccine to get. You know, I think we forget we have this idea, you know, we want 100%. There's no vaccine that's 100%. There's no medication that's 100%. So, you know, the initial studies we saw up in the 90s, and even some of the repeat ones we're seeing now, still in the 90s, 80s and 90s, those are very, very good results from a vaccine. So all of the ones that are available are kind of in that high range. So I would say, again, the vaccine that is available and that you feel comfortable with for whatever reason is the right one for you.
Thanks, Dr. Nefsi. And unfortunately, we are out of time. We did not get to all of the questions today. But I do want to thank Dr. Nefsi, Dr. Ledke, Dr. Morse, and Lisa Peacock for joining us. And I just wanted to end with just a couple of reminder slides, if Ashley could pull those back up. And while Ashley's doing that, the remainder of the questions, we will try to get you some answers on our COVID-19 page on the Munson Healthcare .org website. Some of the specific questions that we did not get to were related to specific health conditions, and in that case I would recommend you reach out to your primary care physician or call our Ask a Nurse hotline at 231-935-0951 to discuss your specific health conditions and whether or not you are eligible for a booster. And there were also some questions about where can I find specific breakdown of data by county, by age group. We'll post that information on our website as well. The MDHHS and the local health department sites are probably the best places to find that data breakdown right now. So the last slide I just want to remind everyone of, as we try to do these press conferences every week to keep you informed. We'll increase our rate of doing these if we continue to have more surges and more information needs to be shared. But in the meantime, please sign up for our munsonhealthcare.org e-newsletter that's distributed every 2 weeks. You can follow us on social media. And again, the FAQ section on our website will be updated by the end of this week with answers to some of your additional questions. So again, things continue to change. We will continue to keep you informed as best we can. Thank you again to all of our participants today. Thanks for joining us and have a great week.
Thanks, Diane.